So I'm Jennie Dickerson, I'm a clinical psychologist and I work for the Complex Psychological Intervention Service in Bristol. That's a good question. I would guess sort of the answer is, I mean, we've got a really broad training in CPI, the therapists that you've got here, and the people that get referred to us are people who've got really long-term, generally quite entrenched difficulties. And there's a lot of evidence that working in short-term ways with these people isn't very helpful. So an awful lot of the work we do have CBT therapists and people trained, I'm trained in CBT therapy as well, but that we adapt that approach to help people engage in therapy who might have massive trust issues perhaps, or who've struggled and perhaps found a lot of other therapies have not benefited them. So they might have given up quite a lot of hope. So a lot of what we do is helping really engage people to give them a sense of hope and to work relationally with the problems that they've got. So perhaps some people wouldn't be able to engage in other therapies because they wouldn't trust the therapist or would assume it's going nowhere. So we really name those dynamics, and some of the therapies that we offer as well as CBT are relational therapies that really name what the problems in talking to other people and trusting other people are. So I would say that is a significant difference, and that therefore the length of what we do can be 6 or 12 months. The longer therapies we offer perhaps are 18 months. And that enables us to work through some of those complexities around trust. And also give people an opportunity, because their lives are often very broadly damaged and affected by things that have gone on. It really gives us an opportunity to kind of consider the range of things in their life a little bit more. That's a great question. I think twofold really. Well, it's about relationships. So it's either about relationships with people in therapy, and I'm always humbled by the people that I meet and really value getting to know people from such different walks of life and spheres and seeing them find ways forward in their lives. That's amazing, and I don't think I don't think you can beat that really. But secondly, it's working with the staff in the teams who are also incredibly passionate and focused and care about people, and being able to kind of form relationships with them and see how they engage with the difficulties they face day on day. And I think that's being able to offer them supervision, support, consultation, get to know them and see how they work. Those two areas are really, really important. Well, a lot of the teams have already got a CPI member embedded in it, so they would go and approach their person in the team, or there's more than one. We've got a system where people can put referrals through to us, and that then we can organise to meet up with people. So that referral is purely to discuss something, so then they can electronically put in a request, and we then will allocate that to a member of staff locally, and then have an opportunity to go and speak to them and consider what it is they're wanting in that request. So whether that's they're interested in referring a service user, or whether it's they're saying I'm very stuck and I'm not quite sure how to proceed, or if they're looking for some specific training or some other way forward. So that's how people would access us.